COPD stands for chronic obstructive pulmonary disease. My name is Michael Snyder. I am a pulmonary and critical care physician at Indiana Internal Medicine Consultants. And I have an outpatient pulmonary practice which deals with the full spectrum of lung diseases. I also practice critical care medicine. In the United States, COPD is primarily a smoking-related lung disease. If you've been a smoker for probably more than 20 years, damage can occur within the lungs themselves as well as the bronchial tubes, to where there's either a destruction of lung tissue, and we primarily call that emphysema, or there can be inflammation in the airways, which we call chronic bronchitis. And the combination of these two together is what we commonly know as COPD. COPD is primarily manifested by someone who has shortness of breath. They may have a chronic cough that may or may not be productive. They may also have wheezing. COPD is primarily diagnosed, number one, based on its symptoms. And then under the evaluation of a physician, you can have what we call pulmonary function testing. And through pulmonary function testing, where we test how much air you breathe in and out, how fast you breathe in and out, how much air your lungs hold, we can see that there is a pattern that is consistent with COPD. In other words, you'll have a decreased lung capacity in one fashion or the other. It is a chronic progressive disease that is mainly treated through the use of medications, pulmonary rehab, and good medical care. There are various types of medications. Some are short-acting, some are long-acting. They primarily treat the symptoms of COPD. The mainstay of treatment for COPD is, number one, to quit smoking. So this is very important. If you can quit smoking, you can alleviate many of the symptoms and actually slow the progression of COPD. So in our practice, we actively treat smokers. We counsel them on how to quit smoking. We refer them to behavioral programs such as the Aspire program at St. Francis, to where they can get a handle on and a plan to quit smoking.